And thank you for joining us on this end-of-the-week news conference. We have much to discuss with you this afternoon. To start things off, Mayor Demings will recognize the significance of this day. The mayor will also share the latest information on COVID-19 testing numbers. He will discuss a CARES Act funding program that helps providers who take care of our precious children. He has new details on strike team visits, the resumption of utility fees, and a look at Head Start as they begin their school year. Orlando Mayor Buddy Dyer is also here this afternoon to discuss the latest details on the city's efforts to combat the virus. He will talk about rental assistance, parklets, testing in the city, and additional details as well. And from the Florida Department of Health in Orange County, we have Alvina Chu, the epidemiology program manager, to discuss the numbers here in the county. We start our press conference off this afternoon with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson, for those opening comments. And as we come today, I have to also recognize today as September the 11th, the 19th year anniversary of that tragic day that we all remember. I remember it very vividly. I was the chief of police in Orlando at the time. And on that day, we had significant challenges throughout the city, the airport, Mayor Dyer, and we all know that nearly 3,000 innocent lives from 70 different countries died on that day in that tragedy. And the brave first responders who responded throughout the nation, but certainly mostly there within the New York area, paid dearly. And since then, many others have died as a result of illness, as a result of the tragedy itself. But one thing also happened, air passenger travel as we know it today changed. And much like the events of 9/11 caused a change in travel security, this pandemic is going to cause some things in terms of sanitary protocols and measures to change in our lives forever. And so we recognize, this confluence of two different major events that has impacted the world on this day as well. And so we find ourselves here today, here within Orange County, dealing with a pandemic, a global pandemic. But I say this, even now in the face of a global pandemic, our nation has demonstrated the resilience to overcome challenges. Let us always remember what makes America great on this Patriot Day. So since the beginning of the pandemic, we here in Orange County have been under a state of emergency for 179 days, so nearly 6 months. Orange County has a total of 37,701 COVID-19 cases. None of us thought we would ever reach that number. I know if you're like me, but we have. We had an increase in just the last day of 215 new cases. 405 residents have died as a result of COVID-19 here within our community. That's an increase of 22 deaths since Tuesday. There are numbers, but there are lives and families affected. So I never want to just glance over the numbers, and so we do offer our deepest condolences to those families who have lost a loved one. Our 2-week average, though, is very encouraging, 4.6%. A 4.6% positivity rate within the last 2 weeks. Remember that this is only for 2 weeks, but our cumulative average is still over 11%. Nearly 328,000 COVID tests have been done in Orange County. Orange County Health Services continues to make certain that free tests are being offered throughout the county. Next week, on Monday, from 1 p.m. to 5 p.m., the team will be in the Bithlow area at the Transformational Village, which is on 11th Avenue. This testing is in partnership with the United Global Outreach Organization. There will also be homeless outreach done at the Bithlow location with Clean the World's mobile shower unit. East Orange County residents can stop by or make an appointment at ocfl.net/testing. Testing will be available for those 12 years and up, and it does not require payment in insurance or anything else. It is free. Also, the team will be in the Conway area next week, Wednesday through Friday, at the Barber Park, which is on Gatlin Avenue. To get information about appointments, you can go to ocfl.net/Barber Park. And let me just transition and talk a little bit about how we are leveraging the CARES Act funding that we've received in our community. The Child Care Supplement Fund program opened up for registrations earlier today at 9 a.m. This is a partnership between the county and the Early Learning Coalition. The program offers eligible child care providers up to $12,000 to cover the cost of expenses related to preventing the spread of COVID-19 at their facilities. There is a total of $4.9 million available for this program. Again, these are child care facilities within Orange County. Child care providers who want to apply for funds may contact the Early Learning Coalition of Orange County. They will provide a list of what qualifies as eligible COVID-19 related expenses. For full eligibility criteria and contact information for the Early Learning Coalition, you can visit ocfl.net/orangecares. On Tuesday, Orange County Head Start began the school year at all 22 of their locations. Head Start is offering both a face-to-face and virtual option based on the parent's choice. Currently, there are over 1,500 children enrolled in the Head Start program here within Orange County. Almost half of the students are signed up for the face-to-face option. The rest are attending virtually. The program received $1.3 million of CARES funding, which allows the program to purchase equipment to ensure that the environments in these Head Start centers are safe. The funds were spent on items such as sanitizing machines, spraying or cleaning machines, disinfecting kits, and masks and face shields for both the students and the teachers. Head Start is taking every precaution to ensure the safety of the children and staff. Back in March, Orange County Utilities announced that service disconnections for non-payment and late fees would be temporarily suspended for residential water and wastewater customers. Our Orange County Utilities has asked me to inform you that starting on Monday, September the 28th, so a little more than 2 weeks from now, service disconnections for non-payment and late fees will resume. Those who need assistance making their account current are encouraged to call the customer service line. The number is 407-836-5515. 407-836-5515. That line is operational between 8 a.m. and 6:30 p.m. Monday through Friday. Customers who have fallen behind on payments are being reminded by Orange County Utilities through bill messages. A postcard has been sent out, phone messages if needed, and or door tags have been hung to inform the public of this change in the disconnection policy. Customers can also view their account balance and make secure payments 24 hours a day at ocfl.net/payutilities. Our business compliance strike teams have been inspecting businesses now for some 37 days throughout the county. Starting tomorrow, our teams will be out on weekends as well. The teams have visited nearly 2,200 businesses with an overall compliance rate of 93%. They have re-inspected nearly 200 businesses. We are currently inspecting the larger theme parks. Earlier this week, the teams inspected Universal Studios Orlando and Universal's Islands of Adventure. Both parks were found to be in compliance. With the governor's order clearing the way for bars to reopen statewide at 50% capacity on Monday, our strike teams will be working closely with the Department of Business and Professional Regulations and the state alcohol and beverage officials. We know that for an economic recovery to happen successfully, all businesses need to be functioning in a safe manner to regain the public's trust. We hope everyone will take this reopening seriously and act responsibly in accordance with the CDC guidelines. And with that, I'm going to turn it over to Mayor Dyer.
Thank you, Mayor Demings, and thank you for your remarks related to September the 11th. Our country is again going through a difficult time, so it's important that we remember how we came together to honor the lives that were taken 19 years ago today, and that we recognize the power that we have when we come together and unite as one for a common cause. As we look ahead, it's hard to believe that we're ending the summer season and entering another season of COVID. We've had a spring, a summer, and now we're headed into the fall with COVID. And while it remains still here in our community, I couldn't be more proud of how our community has responded. I know that there are times that we are all sick and tired of this and wondering when it's ever going to end. But I want to keep encouraging people to do what we've been doing, do your part, because that's why the numbers have come down. That's why we're in the 4%, less than 5% positive range. It's because we've been wearing our masks, we've been social distancing, and we've been taking this seriously. I think since Memorial Day, we've realized that even when the numbers do come down, we still have to continue to do our part. And we're trying to live and cope with this. We're trying to have schools open. We're now going to have bars open. So if we're going to be successful in living our lives and not having another outbreak, we need to continue to wear our mask. We need to continue to social distance. We need to continue to practice good hygiene. We've been diligent about it, so let's keep at it, Orlando. We're in this together, and we got this together. A few updates on city programming as it relates to the virus. We continue to work to support our residents. So on Tuesday at our city council meeting, we approved a partnership with Heart of Florida United Way to launch a rental assistance program to provide CARES Act funding grants up to $10,000 per household for residents to pay past due rent and late fees. We estimate that we can help more than 300 families take advantage. The request for applications portal for the program is live at the United Way website, HFUW, Heart of Florida United Way.org, and look for Orlando Cares under the Get Help section. The portal to request applications opened on Wednesday. They'll go live on the 23rd. But under the requirements of the CARES Act, we need to advertise for a couple of weeks. And also, we wanted people to get the applications and get their backup materials together, which aren't much. You just have to live in the city of Orlando, so you got to provide residency in the unit that you're behind on rent. You have to be behind on rent, and that can be any time from March through October. And then you have to show some proof that the reason you're delinquent has something to do with COVID. So that's pretty much it. Funding will be provided on a first-come, first-ready basis, and residents interested in applying are encouraged to do the screening process now. Don't wait till it's live on September 23rd. Parklets. In addition to helping residents, we continue to look for ways that we can help our businesses in these unprecedented times. So also on that same council agenda, we voted to approve a new parklet program in our downtown CRA. And that allows downtown businesses to expand their retail sales and restaurant seating operations into adjacent on-street public parking spaces. So there's no permitting, no fees, but you do have to make application so that we can determine or make a determination that it's safe to do so, to use that parking space. We're using some CRA funding to provide help with creating barriers and other things that might be needed to do that. We will provide additional space, and the program will be available to businesses, as I said, with no requirements. SALT, we also continue to work and protect and assist our community's most vulnerable. To further help individuals experiencing homelessness, this week we approved funding to expand our support of the local not-for-profit SALT to continue to provide access to showers and restroom and clean clothing and hygiene kits. In closing, I want to reiterate that the City of Orlando continues to expand testing. Next week, we'll be back at Camping World Stadium from 9 to 1. You can go to orlando.gov/COVID-19 to make an appointment. It takes 5 to 10 minutes to actually go through and get tested, so I encourage people to utilize that. Now I'd like to call on Alvina Chu from the Department of Health.
Thank you so much. As Mayor Demings briefly reviewed at the beginning of his presentation, that Orange County has seen a little over 37,000 positive cases since the beginning of the pandemic. The overall percent positivity is at 11.51%. Just recently, yesterday, the daily percent positivity is below 5%, as Mayor Dyer had mentioned, at 4.85%. Unfortunately, as Mayor Demings had mentioned, we have had some deaths reported to us since Tuesday, September 8th. Of the 22 that Mayor Demings mentioned, we have confirmed information for 19. Our sympathies go out to the friends and family of those who have left us. Of the 19 that we know or have known information for, 10 have known underlying health conditions. And so I just want to reiterate about our most vulnerable population, those who have underlying medical conditions who are most at the highest risk for most severe complications and potentially for death. That's to keep in mind asthma, obesity, those with chronic kidney disease, diabetes, also hypertension. Of the 19 deaths that we had confirmed information for, 6 of the 19 deaths were reported with a long-term care facility residential address. So I'd like to bring up the graph, the orange graph, the other graph, that graph. Thank you. The graph showing you the percent of deaths by age group. And so I just wanted, as a visual reminder, for those of you who are visual learners, to understand that for those who might be infected, those who are at the most severe risk are our elderly population. And I want you to keep this in mind as we move towards visitation, reopening of visitation to long-term care facilities. So please, we want you to see your loved ones, but we want you to practice the pandemic precautions. So the wearing of your face mask when you're with your loved ones, definitely careful hand hygiene if you are going to have close contact with your loved one. And also, if you can, for the most part, maintaining a good social distance. I'd like to bring up the schools graph. I'd like to briefly talk about the most recent changes in the age groups with the pandemic. So we are encouraged by the low numbers. However, I would like to point out there has been over the most recent days, particularly these are data updated from yesterday by age group for Orange County, and you can see that there is an increase in the age group for 15 to 24. And so as I had previously discussed about who is getting sick during the pandemic and who's getting hospitalized and who is getting the most severe complications. Essentially, it's young people going out and getting sick and then bringing it potentially to their loved ones in a multi-generational transmission, especially if you live in a multi-generational household or with other family members who might be at higher risk, like your parents or your grandparents. I'd like to reemphasize about with keeping in mind with the bars reopening on Monday, the careful pandemic precautions. So please be aware that as we move into what might be the next phase of our reopening, to not let up on the pandemic precautions, to please wear your mask in public when you're around others, to, if you can, avoid large social gatherings. So refrain from gathering in large groups with persons you don't know or persons you don't normally cohort with, carefully maintaining hand hygiene or good hand washing, and socially distancing where you can. And so that we can maybe not have the task force out reprimanding persons, which we won't be doing, but working with people to hopefully allow us to keep things open and continue to reopen. So as a reminder, Orange County Public Schools will release updated numbers related to the quarantine and isolation notifications on Tuesdays and Fridays. And we will defer to OCPS for any questions. There is a representative here from there. And also as a reminder, we are coming up to the flu season. So I think I had previously mentioned that the pandemic precautions, so all the precautions that we're using now, the hand washing, the face covering wearing, and also the social distancing, all those things that work for coronavirus also work for the influenza virus. And so because of the COVID-19 pandemic, we would like to reduce the spread of all respiratory illnesses. So please remember to get your flu vaccine, which is more important now than ever. With the upcoming season, it might be difficult to determine, if you have a mild illness, some of the symptoms appear to be the same and are often the same. And so it's hard to distinguish between what might be COVID-19 and what might be the influenza infection. And so to get, if you got your flu vaccine, that would at least protect you from at least one of those. So the CDC has been working with vaccine manufacturers to have extra flu vaccine available this season, and we recommend you get the flu vaccine in September or October as soon as it becomes available to protect you for the remainder of the season. So we'd like to encourage the community to follow us on our Twitter handle, which is @GoOrange, and it's Go Healthy. And I'd like to turn it back over to Mayor Demings. Thank you.
Okay, just as a reminder, we do have Mr. Scott Howard here from the Orange County Public Schools. I know that many of you may have questions about the school district, so if you have questions specific to that, we'll ask him to come up and share at that time. Okay, questions?
Lauren Seabrook, Channel 9. Mayor, you mentioned that the strike teams will be working closely, I think, with DBPR on the bars reopening. I know they only are scheduled to work until about 6 o'clock at night. So could you talk a little bit about maybe what they plan to be doing with the bars, if they will be working in the evenings with DBPR? And then just also, if you and Mayor Dyer could also just talk about your feelings on the bars reopening. I know you've made comments in the past about not quite being ready for that.
Well, as you know, the bars, they're licensed alcoholic beverage establishments, and they're regulated by the Department of Business and Professional Regulations. And the law enforcement entity under the department is the Division of Alcohol and Beverage Enforcement. And so that's a law enforcement agency, and some of the violations associated with licensed alcoholic beverage establishments are criminal violations. And so what I have been told is that the DBPR alcoholic beverage special agents, they are prepared to work during the hours that bars are open. Our strike teams are primarily non-law enforcement entities. They cannot make criminal arrests. So this is why there has to be some collaboration. We will receive complaints through our compliance strike teams, and we will appropriately, if it's a law enforcement issue, refer it to alcohol and beverage and/or the local sheriff or law enforcement authorities for any related enforcement. The bars understand, I believe, the opportunity that they have to reopen successfully, and I believe that in some ways they're motivated by the business revenues that can be generated from reopening, and they're going to do the right thing. Sometimes we have bad actors in every group of citizens, and some need more, I think, prompting to do the right thing than others. And so that's why we have the compliance strike teams in place, to make sure that we are prompting them and letting the community know that we're watching, that we are taking all of this very seriously to protect the lives of the people who live here in Orange County.
So I've had great compassion and sympathy for the bars. They're one of the industries, along with, I think, performance arts and entertainment, that have been hardest hit. Most businesses have had the opportunity to figure out a plan to operate during the course of the pandemic. Bars were simply shut completely down, and I've expressed a number of times that, you know, they have one of the hardest business models to figure out how to operate. So we've had a lot of Zoom meetings with bar owners, especially in the downtown area. They want to do the right thing, so we've talked to them, and hopefully they've done this, about having a written plan on how they were going to operate during the course, if and when the DBPR allowed them to reopen. So now that day is here, so I hope they have all done that. We encourage them to work with Orlando Health's Business Ready group to put plans in place, but we thought it was important that they actually have something on paper so that their patrons, their employees, and everybody knew what the rules of the game were going to be and how they were going to try to comply with social distancing and making sure that they didn't have an outbreak within their establishment. But other than that, I'm sympathetic towards them. I do believe, from speaking with probably 20, 25 bar owners in the last several weeks, that they want to do everything possible they can to put their operations in safely, because they know if they're bad actors, they could get shut completely down again. So at least in our community, I don't know about statewide, but I have some great confidence that they're going to try really hard to do the right thing.
Steve Hudak from the Sentinel. Let me follow up on Lauren's questions. Are there thresholds that either of you would have to see in positivity rates or hospitalizations that would prompt you to issue an order of some sort to close the bars again?
That's a difficult question to answer, but what I would tell you is that obviously the Florida Department of Health throughout the state, they keep the data related to any outbreaks and through the contact tracing that is done. And we talk every single day, sometimes several times a day. And if they alert me to the fact that there's widespread outbreaks associated with bars or activities there, then that will cause conversation with the governor and his related order, and we will look then within our own local authority whether or not we need to make any adjustments or not.
From my perspective, I'm going to follow the lead of the health department. You know, we got a lot going on right now, so I don't think it's going to be that easy to determine if we have an increase or a spike in numbers, exactly where that comes from. We've got football games that are going to be played at UCF with 20% capacity. We've got soccer games, the same. Of course, we've got all the kids that have gone back to schools. We have visitation at nursing homes. We have about to start the flu season again. So I don't know that there would be necessarily a positive number, but I just want to monitor and make sure that, at least from our perspective, the bars are trying to conduct themselves in an appropriate manner.
And I'm going to ask Ms. Shu to come forward. She's the epidemiologist manager there within the Department of Health, who really gets to study these numbers on a day-to-day basis. So I ask her to opine as well.
Thank you. I just briefly wanted to mention about, so you were talking about essentially what would be a threshold. So it would depend on, it's not a set threshold for everybody. And so what Mayor Demings had mentioned is a lot of it is based on contact tracing, whether or not we can identify if there's some kind of transmission that has occurred within whatever setting that you're talking about. And so previously in the past, the contact tracers, they do in-depth interviews with persons who are confirmed positives, and then they also follow up with those persons who are who are exposed close contacts to those positives. And through those interviews, we try to identify what might be a common link in person, place, and time to show whether or not there's transmission occurring in a place. And so this would be any kind of place. So long-term care facilities, healthcare facilities, schools, and this would include bars and also our other campuses, colleges, and universities. And so whether or not the places close would also depend on whether or not we can confirm there's transmission occurring in that location. So not necessarily a blanket kind of recommendation.
I know I'm breaking protocol here, but let me just follow up with that. How many contact tracers do we have now at the Orange County?
So it's a variety and it's a mixture. So there's a lot of people doing a lot of work. So most recently, with recent funding, we have hired 69 contact tracers, but we also do have, the entire Department of Health, the Orange County Health Department working on this, as well as we have a collaboration with University of Central Florida. We have student volunteers who are doing contact tracing on our behalf. And then we also have some other community partners who are helping us with with contact tracing, as well as all of our other stakeholders. So including schools and universities and hospitals and healthcare facilities. Thank you. Thank you.
Danielle Lama with Fox 35. Just a follow-up question for you, Mayor Demings. Will the strike teams be going to bars at all, or will it be completely left to the state agencies?
For the most part, it'll be the state agencies. However, if we get specific complaints, they may do some initial fact-finding by which to turn it over to the state authorities or local law enforcement.
Hi, Eric Sandoval with News 6. A question for Ms. Chu, if you don't mind.
Yes.
The numbers that you were showing us with the age breakdown of new cases, I noticed that the largest percentage without the bars opening is already skewing younger. What are your concerns as we move forward? Actually, what are your concerns now before the bars open with school back in session? And then moving forward with the bars reopening and the younger people going out and socializing?
So it's not just specifically bars reopening or kids going back to school or colleges reopening. It's more about what are the behaviors of the people who are going out and perhaps not observing good pandemic precautions. So people who are gathering in large groups and people who are not observing social distancing and people who are not wearing face coverings or masks. And so I don't think it's specifically one event, crystallizing event is going to make or break us. But so I believe I've spoken previously about at some point we have a personal responsibility to our community to collectively prevent additional increases. And so I would urge, you can see that across the pandemic, the people who have the mildest illnesses, but the people who are most infected are young people. And so perhaps they've let up, or you're young, you have a sense of immortality, but this, to be a part of our community, we want you to protect your loved ones who are at more risk for developing severe disease and potentially death. And so we've seen in multi-generational households, especially because if you live in a house, you are a close contact. Whether you think it or not, the teenager lives in his bedroom, still has to eat dinner at some point with his family, or you perhaps share the same bathroom, but these are shared living spaces. So multi-generational households, transmission of the virus is easy, very easy to spread. And so if you are a young person out and about and you potentially bring this home to your family members, they could be at risk for severe illness and potentially death. And so please take that personal responsibility for our community and your loved ones to practice the 3 W's, which is the wear your mask, watch your distance, and wash your hands. Thank you.
Megan Cruz from Channel 9. This question is for both the mayors. We've talked about having confidence in the owners, doing the right thing, but what would you say to patrons who might not have that same sense of responsibility to keep these businesses open?
I'd say to patrons the same thing that I say to everybody, which is if you want the bars to stay open, then you're going to have to behave in a manner that allows them to stay open. So it's in your own self-interest to do the 3 W's that we just chatted about. And then the other thing I'd say to patrons, if you don't feel safe going into one of the bars or one of the establishments, don't do it. That's one way to change behavior of a bar owner or a bar establishment, is not to frequent that bar if you don't think it's safe.
Hi, Deanna Albritton, Channel 9. Question for, I guess, the school district, but also the health department. The rapid testing of the football players, the questions I have are, do you believe that all the athletes should be tested? Why just football players right now? And will their tests be included in the overall positivity rate? I know that Dr. Pino has provided a non-NBA bubble positivity rate in the past.
So, Mr. Scott Howard, there, shoot.
I think, so the policy to test the football players is school-based, so I don't really have any comment about that. The general overall, the health department's view is that people should be tested when they are symptomatic and when they need to be. There is a point where there is a place for screening at some certain scenarios for high-risk settings, such as in long-term care facilities. We do screening for healthcare workers and also for residents because they are at the highest risk for severe complications and for death. So, but the school policy on screening, I'll leave to Mr. Howard.
Sure. So understanding the nature of football and the fact that we've already placed our football players in cohorts to learn together in schools, and knowing that it's a high contact sport, that our cohorted players that are together are one thing, but then once they start competition and start possibly infecting the other schools and then taking it over to the other schools, the thought was to invest in the rapid testing so they could be tested biweekly in order to ensure that the coaches, the trainers, the players are essentially at least testing not positive before they're competing with another team that could possibly be infected and then take it back to the school. So the decision was made to do that. The partnership with Advent Health to move forward with that testing was made. It was endorsed by the Medical Advisory Committee of the school board. And I think moving forward, we want to make sure that our student athletes have as much protection as possible, both on the field and off the field. And that's why we're doing that and going to continue to do that through the 10-week football season.
This question is also for Scott Howitt. It's Eric Mock from News 13. Can you give the update on COVID cases in schools now and why they're still not saying which are students and which are staff?
Repeat that last part, I'm sorry.
Why they're still not saying which are students and which are staff?
So right now we've been giving combined totals and breakouts if people ask. We report those out on Tuesdays and Fridays. We're actually working right now in process and should be releasing it on Monday, is anticipated, a dashboard that'll be updated daily that will break it out, not only total cases and then break it out by staff and students, but also on a school-by-school basis. So you can actually go to the dashboard and see the school and see the breakout by students and staff. So that hopefully will be up and ready to go on Monday. We have staff who've been working to make that happen. We know that the data is extremely fluid. We receive positivity cases that come in from schools daily, almost hourly, and we're continuing to take that data in. We have an intake form that we get the data, we put it into our database, and we're going to start the process of feeding that dashboard. So it is fluid. That data changes, and I know I know that even the Department of Health can tell, as far as the quarantine letters and things, we get those up until in the evening, 6, 7 o'clock at night. And we're continuing to contact parents and families and making sure that they know at the school site when there's a case, when there's quarantines, and what they need to do in response to that. And again, this affects our face-to-face students, of which about a third of them are in school in our 202 schools, and about a quarter of our schools so far have reported a positive case. We will be reporting data tonight, just like we have on Tuesdays and Fridays the last couple of weeks. And so we'll be posting those this evening after we alert our parents of that data.
Thank you. This next question is for Mayor Dyer from Nadine Yanis with WKMG. The Dr. Philip Center for the Performing Arts confirmed they will begin welcoming guests for big events like the Orlando Ballet next month. Are we ready to bring back the arts, and what would that look like in regards to safety during this time?
So I know what they are looking at is not opening Steinmetz. They're looking at whether they can accommodate some performances in the Disney Hall, which is 2,700 seat capacity, so they will figure out how to social distance like they're doing in stadiums and like we're doing in here. I don't know the specific plans, but I am aware that they're looking at that. We'll do it in the bigger hall with fewer people.
Thank you. The next question is from Ryan Lynch with Orlando Business Journal. It's for Mayor Demings or Mayor Dyer. Having spoke with bars on reopening plans, is the city or county looking to provide any additional assistance to reopening bars or breweries? If so, what support?
So in our downtown area, we have the Downtown Development Board that is working with bars and again, encouraging them to have business-ready, business opening plans and to put that into writing. But we have some of our personnel that are getting up to speed on what are best practices and are helping them with their plans.
What I would tell you is that the reason why we have our compliance and strike teams in place is to be proactive. And if a bar owner or brewery makes a request, we certainly can have staff go out and meet with them and share with them what the best practices are. We can provide them with PPE if necessary and other types of collateral material that can be used to encourage social distancing and other things. So we're here to work with them, and so we're doing that in a proactive manner. Okay. And it appears that there are no other questions. I'm surprised that Michelle Meredith didn't ask a question. But thank you all for being here this afternoon. We'll see you soon.